Running the iStat cartridge in analyzer to perform patient blood test. There are three major steps. First, preparation of the iStat analyzer to run the test. Second, sample collection and cartridge dosing. And finally, running the test. Ensure following material is available to successfully run the test. The iStat cartridges. Individual cartridge equilibrated to room temperature for at least 5 minutes. An analyzer with enough battery charge, the sample collection devices, and if necessary, the tube and the cotton or gauze piece or tissue paper to discard few drops of sample. Now let us learn to prepare analyzer to receive the cartridge loaded with sample. Press on/off key to turn on the analyzer. Analyzer screen displays the test menu with two options followed by the logo. Select option 2, iStat cartridge. The display prompts message for operator ID. Scan or manually enter the operator ID. If set to validate, the prompt will be repeated. Next screen displays prompt for patient ID. Scan or manually enter the patient ID. If set to validate, the prompt will be repeated. Keep the cartridge pouch on flat surface. Press and hold the scan key on analyzer, ensuring the entire barcode printed on cartridge is covered. Analyzer will accept the lot number and screen displays insert cartridge. Now hold the cartridge pouch from sideways. Do not press the center of the pouch. Open the pouch straight from the notch given on the edges. Tilt the pouch slightly to slide the cartridge out. Hold the cartridge from the thumb area provided at the bottom. Do not touch the center. Sensors and sample well on the cartridge. Keep the cartridge on flat surface near analyzer. Sample acceptable for testing with iStat system are arterial and venous whole blood. Avoid air bubbles in the syringe. If collected in plain syringe, test the sample promptly. If collected with heparin, ensure to fill the syringe to the capacity and mix well. For blood gases, perform the test within 10 minutes. Electrolytes and cardiac biomarkers within 30 minutes. PT-INR can be performed by skin puncture and hanging drop method, whereas for ACT test, do use only the plain syringe without any anticoagulant. Now let us understand the sample handling and dosing. Collect the patient sample in syringe. Mix the sample well by gently rolling the syringe between the palms vertically, horizontally, and by reversing at least for 30 seconds. Remove the needle and discard first 3-4 drops of the sample which is exposed to external environment at the tip of the syringe. Immediately fill the cartridge by touching the tip of the syringe to the sample well. Fill the cartridge to the fill mark. Hold the cartridge sideways between thumb and index finger. Avoid touching the sensors and calibrant pouch. Close the cap of the sample well completely by folding it using the extended filling provided to the cap. Do not press the cap at center to avoid the sample push beyond fill mark. Hold the cartridge at the thumb axis provided at bottom. Few cartridges have push closure instead of snap closure. For closure, it can be pushed towards the sample well after dosing the sample. Now insert inside the cartridge port to run the test. Analyzer will display several prompts while the test is in progress, such as identifying the cartridge type, calibrating and analyzing. Tentative time to test would also be displayed in form of a bar chart. Cartridge lock will also be displayed on screen at bottom. While the cartridge is running, Do not move the analyzer or pull the cartridge. Results will be displayed on the screen. Beep will be heard. Align the infrared windows of the analyzer and the printer closely and press Print button to print the result. Press 1 to release the locked cartridge. Pulling the cartridge prior to this will damage the thermal probes. Remove the cartridge by gently pulling after pressing key 1.